Hello, everyone. Welcome to a conversation on health disparities in rural New York. I am Diane Euler, Vice President of Programs for the Health Foundation for Western and Central New York. I'm excited to share that we have over 200 people joining us today, and we would love to know where you're all tuning in from. So as we're getting started, if those of you who have entered the room and entered the webinar, if you please use the chat to let us know what county you're viewing the webinar from today, that would be wonderful. So while you're doing that, I'd like to take just a few minutes to tell you a little bit more about the Health Foundation, and then I'll introduce you to the facilitators for the hour. The Health Foundation for Western and Central New York serves 16 counties in upstate New York, 8 here in Western New York, and 8 in Central New York. Those counties include 2 of upstate New York's largest cities, Buffalo, New York, and Syracuse, New York. But most of the counties that the Health Foundation serves are rural, and there's several small cities and many, many small towns and villages. So we are very proud to bring you this discussion and happy to support the work of our community partners in our rural communities. In 2020, the Health Foundation adopted a new strategic plan. That strategic plan centers both economic and racial equity, and it reaffirmed our commitment to improving health outcomes in the rural communities that we serve. We also reaffirmed our commitment to 3 specific vision areas: early childhood, children from ages 0 to up to 5, older adults, and support for community-based organizations that serve those populations. Our priorities for the next 5 years, extending well before the 5 years in the case of some, and it'll probably go on for many years, our priorities include promoting resiliency and trauma-informed practices, supporting social and emotional learning in young children up to age 5, partnering with others to spread and build age-friendly communities and age-friendly health systems, working to improve birth outcomes and maternal health, expanding and strengthening services for family caregivers, and supporting efforts to improve access to healthcare and the quality of healthcare. Over the years, we've developed many programs that some of you have likely heard of. Many of you may have participated in those programs as well. A few of the better known ones include PETALS, Help Me Grow, Co-Creating Wellbeing, Aging by Design, and of course our Health Leadership Fellows program. And a special welcome to all the fellows that are joining us today. The Health Foundation also partners with community members to advocate on a wide variety of issues that are intended to strengthen safety net and to improve access to healthcare. And we occasionally will commission and disseminate the learnings from a report, helpful information on the communities that we serve. In today's conversation, we will be discussing a variety of issues that were highlighted in our most recent report, Community Health Needs and Opportunities in Western New York Southern Tier. And for those of you who are joining from elsewhere in the state, the Western New York Southern Tier includes Chautauqua County, Cattaraugus County, and Allegheny County, all beautiful places. I'm very happy to welcome and introduce you to 2 extraordinary women who did a lot of the legwork on the report for us, Sharon Matthey and Kate Ebersol. Sharon and Kate, I'm going to turn it over to you so that you can please tell everyone a little bit about yourselves and then a little bit more about the report as well. Thank you.
Take it, Sharon. Logistics and anything else you want to say about yourself.
Good day, everyone, and welcome. I am Sharon Matthey, and I am one of the 300 fellows that are part of the Health Foundation for Western and Central New York's Health Leadership Program. And you can find more information about that on the Health Foundation's website, which I will put in the chat in a few minutes. My job is to deal with the logistics, so bear with me. We don't have to worry about the restrooms, but there are other pieces that we'd like you to know about. First of all, with over 200 registered participants, we are going to mute the audience. So please use the chat if you have questions or comments. If time allows, Kate will introduce those questions to our panelists. We are also recording this session, and that will be made available to participants at a later date. We are saving the chat so that we can glean any important pieces of information that you would like to share with us. Now I'm going to turn this right over to Kate, and she will lead us into the really important parts of this hour-long webinar.
Thank you, Sharon. And I have to say I'm both honored and pleased to be the moderator for today's panel discussion. We have 6 wonderful panelists, and I don't want to take a lot of time, but I did want to take just a minute or two to explain what Sharon and I did back in 2020 in terms of the collection of the information. And by the way, for those of you that are not familiar with it, is a report that Diane, that doesn't come in very well. Okay, I'm a blurred background person, so maybe it's on the website though. You can link it on the Health Foundation website. Sharon and I met with Diane. We talked about the updated target populations for the Health Foundation and what was going on in the Southern Tier in terms of their target populations. Sharon and I both are very blessed to have extensive experience in the 3 Southern Tier counties, and we then proceeded to do an outreach effort in which we planned and talked with quite a few people. It was 2020, so we didn't get to see a lot of people in person, but we did talk to a lot of people. We collected a lot of information. We really tried to find out what were the organizations that were actually working in the space that the Health Foundation had identified and that were established organizations, but also what were some of the more organic activities, initiatives, groups who were doing good work in the Southern Tier. And we pulled all that together, presented to the Health Foundation as of about December, I believe, of 2020. And then earlier this year, they did come out with that report, the Community Health Needs and Opportunity in Western New York Southern Tier. The questions we're going to be asking the panel today all come and are referring to that report. We're going to be asking them about activities going on in the Southern Tier. And so let's just jump into it right now, because we've got 6 people who really know a lot about the Southern Tier. I'm going to have each one of them briefly introduce themselves, and I'll call out a name and just as we talk, just briefly introduce yourself and what area of the Southern Tier you work in. So Andrea.
Hello, I'm Andrea Spako, and I grew up here in Allegheny Territory in the Seneca Nation territory in Cattaraugus County. I grew up here, born and bred, and have been honored to work with our own Seneca community members for the past 23 years in the healthcare field, between a dental assistant and an exercise specialist. So.
Great, thanks, Andrea. I'm just going to go in terms of how I see people on the screen. Tina.
Good afternoon. I'm Tina Zerbian. I'm the CEO with Connecting Communities in Action. We are the community action agency that serves Cattaraugus County, but we do have services that extend into Chautauqua, Allegheny, Wyoming, and Livingston counties as well.
Great, thank you, Tina. Helen.
Good afternoon, everyone. I'm Helen Evans with Ardent Solutions. I'm the Associate Director, as well as the President for the New York State Association for Rural Health. And we serve all rural counties across the state through the association, and Ardent Solutions is based in Allegheny County, and we have services that go into Steuben, Cattaraugus, Chautauqua, and of course, Allegheny County.
Great. Pastor Schlo. Okay, we may have lost Pastor Schlo for a little while. So, Christy.
Hi there, Christy Thornton. I am the Executive Director of the YMCA here in Olean. And of course, we have association. So I specifically work in Cattaraugus County, and we also reach through to Allegheny County with many of our services as well, and have a Y out there.
Great. Amanda.
Hello, everybody. I'm Amanda Giesing. I'm the Executive Director of the YWCA in Jamestown. And we also serve primarily the Southern Chautauqua County, but we do have programs that are throughout Chautauqua County.
Great. And I'm going to stick with the program. It's unfortunate that we have lost Schlo. Maybe there were some technical difficulties. Hopefully she will be able to rejoin us here quickly. Andrea, for you, what resonated? Oh, there's Pastor Schlo. Why don't you start it off with what resonated, or Schlo, can you get on now? Hopefully, and introduce yourself briefly. Cool.
Hi, I'm Pastor Schlo Smith. I'm from Jamestown, New York. I'm preaching somewhere throughout the county every Sunday. I'm also a local activist, community organizer, and I work at Jamestown Business College as an adjunct instructor.
Great. Thank you. So glad you were able to jump back on. So, and what resonated for you in the report?
Did you say me? Sorry.
Yes. Yes.
A little gap there. I want to first say what a wonderful job that you and Sharon did putting this data together that really tells a lot about where we're at in these three counties, and especially during this very trying time during 2020. So I understood that, we couldn't get the full, snapshot at that moment, but it definitely gave me enough information that that we have to do more. I think one of the things in the very beginning of the report that really resonated with me is the lack of trust that a lot of people have with their healthcare providers. Whether they have good intentions or not, the trust and the lack of mental health support there. So as I had stated in a previous discussion, I was very overwhelmed by all of the information in this pamphlet. And my first thought is always to just, how do we fix this? How do we fix this? And what can we do? What more can we do to serve every individual, no matter their income and no matter their location? So I honestly just had to sit with it for a little bit, because it was unfortunate that we do have so much health disparities yet, and I'm thankful for all of the wonderful partnerships and the organizations that are doing something to empower people and communities. It's just sad to see that we're still, we still have people that don't have affordable health care or access or adequate health care. And of course, with the social isolation and things that we've all kind of had to experience, we really hit the populations that the Health Foundation is trying to serve. So it was overwhelming.
Yeah. Thank you, Andrea. Pastor Schlo, what resonated with you from the report?
I really appreciate the overview that was given in the report. First, I'd like to say I'm grateful that Chautauqua County is included in the vision of the health department for their new strategic plan and vision. I was impressed, and what resonated me was that racial and social economic equity is a priority for the Health Foundation at this time. And I would like to say personally, I love that the Baby Cafe was featured in there. And I appreciate the support that the Health Foundation has given to the Baby Cafe to give them a better governance strategy and to build their capacity. So the things that they're speaking forth in the booklet is things that I already see taking place in Jamestown.
Great. Thank you, Schlo. Other panelists, what resonated? Any one of you who wants to jump on, unmute and jump on, what resonated in the report for you?
I'll jump in, Kate. I think that in the very beginning, the focus on the high rates of poverty across our region was, well, it's near and dear to my heart as an anti-poverty organization leader, but I think that we should also use caution that poverty rates they're the only gauge that we have to judge what's going on in our communities. But the reality is that when you look at those poverty rates, they really only reflect people who live at or below 100% of poverty. They don't reflect all the people who are still struggling to get by every day. And I think when you look at some of the other factors that you list here, like transportation and housing and access to care, those are all so closely linked to our very, very high poverty rates. So that's what resonated with me.
Yeah, great. Thank you, Tina. Other thoughts?
Yeah.
Go ahead.
Sorry, I was just going to say the call out for the challenges for nonprofit organizations, specifically how the organizations have to focus on keeping the doors open, which really limits our ability to improve or expand our programming, and the attention paid to the frontline staff as well, and the pay inequity there, or the lack of pay, which makes high turnover and just difficult to recruit quality staff.
Yeah, Christy.
I enjoyed seeing and understanding the need for the continued collaboration from what we would consider the non-traditional health organizations. I think very often we sometimes forget or underestimate those non-traditional organizations, and we sometimes maybe not understand what they can offer us sometimes, and that's why we come together in all of our groups that we do in Allegheny County and Cattaraugus County and Chautauqua County. So, and I'll use the Y as an example, to where we have mental health collaborations right in our own Y, or whether it's Catholic Charities who are meeting the needs of grandparents raising grandchildren. So I think it's very fascinating, our smaller communities, that we will use those non-traditional organizations to really continue to meet the needs, because there's so many out there, and it may not be that traditional setting, but we know that we have to continue meeting those needs, and we just pull together in all of those ways to come together to meet the needs of the community.
Yeah, great point, Christy. Thank you. Helen, did you want to add anything?
Good. Thinking about when the report was written and when you did your research, and Sharon and Kate, I feel bad that, COVID was in the midst of you trying to do this research, but I do think COVID opened and finally awoke the world to the rural urban gap. And I think that was so reflective in the report, that the differences in health status and socioeconomic vulnerability, health access, and health related behaviors like smoking, drinking, poor nutrition, or violence are deeply rooted in the culture of the rural communities. And we're facing things like child deserts and food deserts that are plaguing our communities. And the whole lack of trust and the feeling of being judged by those in power was reflected in the words of preventing people and those that are most vulnerable from seeking help from the organizations that are funded to help them. So I just want to, reflect on that as well.
Yeah, lots of great points brought out by all of you. And just before we get off this topic of trust, because it does play such a role, Sharon and I really, we heard this firsthand from folks we talked about, that in rural communities, for example, and for other reasons, whether rural communities or within marginalized populations that are tend to be distrustful of people in positions of authority, and that can be a challenge in and of itself to access to healthcare and leading healthier lives. Just briefly, anybody want to say anything more about that trust issue?
I would like to add, in our YMCA, and we are the largest childcare organization, and right now in after school care and summer care, we have 6 after school sites, including a very large middle school site. And I will say, when it comes to marginalized or with children of ethnic backgrounds, minorities, I would say that trust is the lack of trust has gotten larger. And through COVID, I will say that, they were left on their own, and I'll use Olean School District as an example. They were going to school through COVID, following COVID and through COVID 2 days a week, and they were off 3 days a week. So unless they were going to a childcare program, they were home by themselves. They were, and I'll use middle school as an example. So when it came time to go back into a childcare program or go back to school, I will say it was really rough. And coming back into rules and regulations, I will say that trust in itself has really affected, our staff and the children, and how we are working with them on, it has nothing, our rules have nothing to do with, the color of your skin or our expectations. It has everything to do with our rules and regulations, and we want you here, and you're a part of our family now at this point. But everything has changed a little bit since coming out of COVID, and it's so apparent more now than ever. And I don't know if anybody else is on that has worked with kids that has seen this as much as we have in the Y, but it is greatly apparent after coming out of COVID.
Yeah. Okay. By the way, there was one comment made, a question from the chat. Helen, you mentioned child desert. Could you briefly explain what a child desert is?
It's a child care desert. So in our rural communities, yes, we lack child care providers, which make it very challenging for families to work, or for kiddos to have early access to education and screening. So yeah, our child care deserts are difficult.
Yeah, great. Thank you for that explanation. So one of the things that a couple of you touched on, the fact that there's a lot of different organizations, established organizations, but also a lot of work being done by coalitions, consortiums. And I know one of those areas is trauma and trauma-informed care, which is another target area of the Health Foundation. I know, Tina, you've been very involved. Helen, you've been very involved in that. Tina, you want to tell us a little bit about what's been going on in Cattaraugus County?
Absolutely. And this actually addresses the whole concept of trust as well, because understanding trauma and adapting trauma-informed principles means allowing that trust to build with the people that we serve. So I think that's there's a very strong connection here. In Cattaraugus County, we've had a couple of really fantastic efforts going on. I think those have been consolidated now. We've had a countywide trauma-informed coalition since 2017. And I believe we now have over 100 members in our coalition. We meet bi-monthly. Some of the things that I think that we can hang our hats on in terms of accomplishments, we have 2 nationally certified NEAR trainers. That stands for neurobiology, epigenetics, ACEs, and resilience. And we've trained, hundreds and hundreds of people in the community. We've also trained 12 people who can go out and do their own presentations around adverse childhood experiences. We've shown the film Resilience, the biology of stress and the science of hope to hundreds of people as well. We are our agency is part of a smaller coalition that's doing a sort of a pilot project. So we are Community Action, the Department of Social Services in Cattaraugus County, the probation department here, and mental health, or the Department of Community Services. We are working hand in hand with the University of Buffalo's Institute for Trauma and Trauma-Informed Care to develop a toolkit around the 10 implementation domains in trauma. And once we work through that within our own organizations and implement those, we'll be able to take those back out to other members of the community. We are a recipient of one of the co-creating well-being grants. And so we've developed trauma toolkits for customers, as a matter of fact. And we also have a trauma resource list that lists every single therapist who has any sort of trauma-specific certification in the community, and other services that are trauma-informed. I want to say, though, that as far as we've come, we still, I think, as a community, focus so very much on the risk factors that lead to poor health outcomes. Things like smoking or substance abuse or unprotected sex or poor diet. And we still have to go upstream and start to address the trauma, the emotional and cognitive impacts of trauma that actually lead to those risky behaviors. So we've come a long way, but we have a way to go.
Great summary there, Tina. Helen, I know there's been work being done in Allegheny County for quite a while around trauma and trauma-informed care. I want to say a few words about that.
Sure, I'd be happy to. The trauma-informed communities throughout Allegheny County, or as we like to name it locally, or reference it, is TIC-TAC. We're a coalition of governmental agencies, faith-based representatives, universities, school districts, health and human service organizations, behavioral health providers, and community residents who are all committed to making Allegheny County a trauma-informed community. We were really fortunate because in 2018, one of our founders of TIC-TAC, Allegheny County, because of her efforts, Allegheny County became the first county in New York State to pass a countywide resolution that encouraged the entire county to be trauma-informed. Retired Commissioner of Social Services Vicki Grant championed those efforts, recognizing that trauma and adverse childhood experiences are the root cause, as Tina was saying, to so many of the challenges facing our families face in rural communities, including generational poverty and generational trauma, complex trauma, and historical trauma. So we formed to better understand and mitigate trauma. And as the report indicated that you reported, Allegheny County is socially and economically deprived, and our trauma began back as far as our ancestors settling into the county. And so looking back throughout our history, we recognize that historical trauma still today, it plagues our community and our residents, from lack of trust in outsiders, only wanting to take care of our own, and recognizing that the county's peaks and valleys in its economics also are well documented throughout our history. And so healthcare providers passing through for loan forgiveness and then moving on to bigger practices, more social economically lucrative practices, or industries starting, opening their doors, bringing jobs, and then closing to move to another state or another area due to tax cuts or issues. It all is impacting communities from past generations today, and if we don't do something, will be impactful on our future generations as well. So what we like to really think about is how we as a county, which is part of the Appalachian region, can really start thinking about trauma and making changes and shifting the way that we think and the way that we're interacting with individuals that we're supposed to be here to serve. So what we've been doing is TIC-TAC is really moving towards increasing professional knowledge. We do Fourth Wednesday workshops every month. We also, thanks to the efforts of Angela Tinder from Department of Social Services and Scott Halleck, we have implemented what we call a One Caring Adult campaign. And One Caring Adult is really giving language and information to volunteers within the community, our coaches, our teachers and faculty and staff in schools, to dance instructors, whomever, recognizing that it only takes one caring adult to change the life of a child. And so we're giving them information. We've created a website where individuals can go to get education and information about trauma and trauma-informed care. We borrowed from Tina and the Cattaraugus County Coalition. Their directory is up on our website as well, but we also have a directory of providers and therapists that are in Allegheny County that provide trauma-informed services. And then now we're working towards helping the overall system of care to embrace trauma-informed principles and start, like Tina was saying, build the trust between providers, professionals, and those that we serve. So we're very fortunate to be a co-creating well-being recipient as well. And just are in the infancy stage of making an impact when it comes to trauma. And we like to think of it as, I'll give an analogy, that beyond rural being a marginalized population, we would like to argue that rural communities face systemic oppression due to our zip code, and that we have to advocate louder, and we have to be more assertive when it comes to looking for equity, inclusion. And what I really want to, point out is that Allegheny County, although we're socially, economically disadvantaged, we are rich in resources and passion. And we're focusing on the root problem to address our health disparities and our social determinants of health. If I can use an analogy really quickly, trauma is like a hydra. And we can cut off one head and two will grow back. If we're working in silos trying to cut off the head for substance abuse or mental illness or homelessness or violence, child abuse, we can never conquer what's at the heart of the issues, which is trauma. And so that's where we're focusing our efforts. Thank you for the opportunity to share that.
Yeah, thank you, Helen. Thank you. Any of the other panelists want to weigh in on this the trauma-informed care, either the organizations that you know of that are doing some work? And I do want to call out real quick to the Health Foundation for helping to support a recent trauma symposium that we held in Cattaraugus County, and the Health Foundation were very generous supporters of that. And we had actually Vicki Grant as one of our speakers. Anyone else want to weigh in on this topic?
I just want to say to Helen, it's like you were just speaking my thoughts about trauma and the passion and the strengths, because I feel that's we have the trauma over us and historical trauma and everything, and even just this past couple of years, more trauma added to that. But we do need to focus on strengths. We need to focus on our community's strengths versus always focusing on what is going wrong. And I think that's been important over the years with me and working with my community, is trying to get them to see there's, we have a rich culture. The Seneca Nation has the rich culture. And yes, we have a lot of trauma embedded in our culture, in our history. But I think once we start that, that lesson of who we are as a people first versus what has happened to us, that's where we could start the conversation to remind not only others but ourselves that we are very knowledgeable, and we come from a strong ancestry of wisdom and survival, but thriving. So I really, as you were speaking, Helen, it really I'm like, this is how I speak about my community. And I'm thankful for all of the work that you're doing, and Tina, the work you're doing here in Cat County. And so I think is definitely at the base and the center, the base of what we need to be, we always have to focus on. And then I just want to add, as a mindfulness teacher, I think that's the one thing when I try to teach teachers how to be more mindful in their classrooms or be mindful with, their patients, it always starts with us first, so I always try to get them to start and look inward and start with their own practice first, because that's the only way we can really, push that, if we're mindful and we're trauma informed and we look at our own biases, then we can be better providers for the people we serve. So it's great work, and I know that you're all focusing in on not only our community and the outcomes, but we're focusing on the people we are, our employees and stuff. So great job.
Yeah, great overview of some of the work going on around the trauma-informed care across the Southern Tier. Wanted to then ask a little bit about maybe some more. We've mentioned a couple times there are the traditional organizations, of which those that many of you represent. There's also those grassroots kinds of organically developed initiatives that are happening across the landscape. Amanda, ask you about any of your thoughts around what's we call it grassroots, grass tops. What's happening organically that you're aware of?
Yeah, I feel like in Chautauqua County, there's been a lot of organic movement around diversity, equity, and inclusion. Just that really intentional focus on building trust with marginalized communities, with understanding that we need to center the voices of people of color, and recognizing that the organizations also have to do some internal work before they're able to accept and receive that feedback from marginalized community members. And so a lot of organizations are really working on addressing biases and structures of their organization to make sure that they're eliminating hurdles to building that relationship with the community, whether it's at the doctor's office or at a school or at a community organization. We know that if somebody has that first interaction with the organization and they do experience a bias or a microaggression, they're not going to want to go back. And so it's understanding that we have to kind of develop a culture within our organization that's accepting of feedback, accepting of individuals by getting that feedback from our community members on what it is that we need to do to make sure that we are being welcoming so that we can build that trust. In Chautauqua County, there's the IDEA coalition. There's a lot going on around that with the YWCA and United Way. So there's a lot of organizations that are working to work on DEI initiatives.
Yeah, and interesting. There was a pattern there between what you just mentioned, Andrea, with mindfulness has to start here, and you also mentioned it from an organizational standpoint, Amanda. It has to start within the organization first, and only then can you do the outreach to actually meet people where they are. Christy, your thoughts on this, the organic grassroots things happening?
Absolutely. My world in a YMCA really revolves a lot around youth development. So right now, one thing that we see a lot of is collaboration, of course, within the community. And one thing that happens quite often and is interesting, because I talked a little bit about the outcomes from COVID and whatnot, but we see a lot of collaborations with our local schools during the summer. And it's one thing that we haven't seen prior to this. And I know many people on this call probably grew up with recreation, so every morning I got up and I put my shoes on and I ran down to our local park where we ate lunch and we went roller skating or swimming. I grew up in Allegheny County, so we went swimming to Rushford Lake or roller skating to Wellsville. But they don't have things like that anymore in our local towns and villages. And so right now our YMCA is partnering with SIO School in Allegheny, Limestone School, and Bolivar Richburg School, because they want something for their youth, so that is something that we haven't seen before. But what is so exciting about this collaboration is that the Y and the school see that need. They see that need for the youth to be active and engaged in that socialization, because we all know what the kids are doing during the summer if they're not busy. They're sleeping in, they're on the video games, or they're just doing those things that just kind of keep them in the house, and they're not outside learning new sports, learning new games. Along with that, we are finding that a lot of grant funders are looking to get kids outside also, looking to gear away from children not having the chance to learn different sports. So for example, example, Ralph Wilson, looking to get kids out of the house, and they don't want kids to have to go to the Y. So when we talk about not being able to get proper transportation, so, they're sending it's almost like, say, the Y without walls, so we're going out to Whitesville, where we all know, if anybody's ever been to the Whitesville area, I know we have people from all over here. It's not around the corner from places, so we're taking a YMCA, bag of YMCA stuff out to Whitesville or Richburg, or Rushford, places where parents may not be able to get their children to where their kids could play with YMCA staff and learn a new sport. So we're learning, that's what we're seeing, is that people are realizing that their kids need to be out, that kids that aren't even theirs need to be out learning more tools of the trade, or how to have fun outside their house, learning a sport, just getting outside, running around. On that same token, the Y is all about youth and our older population. So our older population, they really suffered through social isolation, and that's one of the things that we work on very heavily here too. And just again, that collaboration piece of how we can reach as many people, so we're constantly finding a lot of different we're fielding a lot of different collaboration opportunities throughout our community for that same thought process. So when we talk about the grassroots, just constantly looking for ways, and we're not the only ones, just like we've heard from the panelists, of folks that are constantly looking for that way to meet the needs within the community and how to do so. So I think in the previous discussion, that generational poverty and it goes along the lines with that historical trauma, the generational poverty or the generational issues that we're seeing is learning how to get our best kept secrets out there. So we have all of these great programs in each of our organizations, of everyone that's on this call, and how can we use our grassroots and our grass tops to get the word out there and make sure that we're not the best kept secret. And I think that's the biggest obstacle that a lot of us are up against, is getting all of these great programs out there. And I know that's the Y's biggest obstacle, and I imagine it's hard for a lot of people on this call as well.
Great, thank you, Christy. Anyone else want to weigh in on this whole idea of things that are happening organically in their community that maybe is flying under the radar, that that still is making a difference for your communities?
I would like to talk about what's happening in the Black community in Jamestown as a result of the upheaval that happened within our country after the murder of George Floyd. The Black community has mobilized, and myself and two other pastors, Lee Croft Clark and U.V. Stewart Jr., meet regularly with the Black community. And so here we are going back to that issue of trust. So our first initiative included going into the New York State police reform initiative, where we went line by line through that whole pamphlet. And as a result of that, we were able to meet with our sheriff, Jim Controne. We were able to meet with our local police chief, Tim Jackson, and officers. Over time, this was over a 1.5 year period. So meeting with our law enforcement, meeting with the community. So here we are in the midst, and we're at the beginning, but we're in the process of developing a more trustful relationship between the Black community and law enforcement. And I'm very pleased that we are in the midst of facilitating that. That's so important. Especially in this hour. And our second initiative, I'll just talk about one more, is that we're currently meeting with our superintendent, Dr. Kevin Whitaker, and we are seeing in what ways we can, because we've seen the data, And it's very disturbing how poorly Black children are doing within our school system. So we are meeting to set forth practical steps that we can move forward and to better help our children of color, period, who are not doing well academically. So as a result of that, our hope is this fall to get 2 African-American navigators that will be able to help children and be that bridge between the school system, students, and parents, and begin to help them to do better, because it's about relationships and facilitating relationships that have been broken down over time. We need to rebuild those relationships.
Wonderful. Thank you for sharing all that, Pastor Schlo. That it resonates for me that that the Jamestown Black community took something that was, tragic, and yet made it into an opportunity to create better relationships. And it really speaks to what we've talked about quite a few times on this webinar, that one of the major issues, along with trauma, marginalized populations, poverty, there is that trust issue, and that is a huge issue in rural communities, and that it takes many, many forms. And so great that you are trying to address the trust issue in your own community. So we've heard quite a bit from everybody. Thank you all. You've been sharing such wonderful information. As a last piece for this webinar and for our participants, it'd be nice to hear what each of you, what are you feeling hopeful about? What is bringing you hope at this time, in whether for yourself personally or for your organization or for your community? And I'm just gonna go around again as I see people and just call out names. So Andrea, what's bringing you hope these days?
I have thinking of a grassroots in our community. We have had people, mothers, Seneca mothers against drugs, stand up and say enough is enough, and let's get rid of these drug houses, because they don't feel safe anymore in their neighborhoods. Their children can't ride, their bikes down the road without there being some drug interaction. So the groups in our community, such as the Seneca Mothers Against Drugs, become SMAD, they give me hope, because it makes me want to, it empowers me to say, when there's something that I'm fed up with, I can stand up and I can do it. And then all of a sudden people will rise with me, like they did in this group. And so they have a wonderful, a large group, a large following for both Cattaraugus and Allegheny territories. And it's just because they want safety. They want their children to be safe. And because of that, the Seneca Nation government supports them. And just the other, this past week on, I think Friday, they had a huge bike raffle, and the Seneca Nation partnered with them, and they offered all of this, it was called the Slow Roll. And I'm proud of the women that stood up and said enough is enough. And that gives me hope, because we might be here quiet and we might grumble quietly about something that we're unhappy about, but it just takes one to stand up and say something, and then people will come together, and there is a collective there, because everybody wants to be happy. Everybody wants to feel safe. Everybody wants, to be healthy and have good health care. So that gives me hope that we have a lot of resources. We have a lot of money. There's technology. There's a lot out there to, we're in a better position than we were 20 years ago. So it's just going to get better. So.
Great. Thank you, Andrea. Amanda.
Sorry, I lost my mouse. I think what gives me hope is really employees kind of, the report talks about low wages, employees not working for low wages and kind of demanding higher wages, and people actually recognizing that. So getting money from funders to help actually pay employees livable wages and above minimum wage. I'm hopeful that that'll help with the recognition that this work is hard work. And it's not hard work because we're doing it wrong. It's hard work because we're dealing with people, and people aren't widgets. And there's no direct end to any of the results that we're doing. And so, I think I'm hopeful that employees are doing this, because I'm hopeful that it'll start putting a highlight the work that we're doing and that the importance of it.
Great. Thank you, Amanda. Pastor Schlo.
I do want to talk about Chautauqua County and how they currently have the Chautauqua County IDEA Coalition, which stands for Inclusion, Diversity, Equity, and Accessibility. And the goal is that county-wide, we provide a place where everybody belongs and has an opportunity to thrive. And they're especially reaching out at this time to historically marginalized community. So imagine a collaborative effort that is county-wide. The city of Dunkirk has signed up. Jamestown, the city of Jamestown has signed up. Dunkirk school system, Jamestown Public Schools, Jamestown Community College. People at grassroots level, faith organizations have all signed up to collaborate and push forward collectively an effort to establish a more equitable county for all. So I'm very pleased to be a part of it. If anyone is on from the IDEA Coalition, can you put the information in the chat? Because I'm on my phone and not on my computer anymore, but I'm so pleased to be a part of this effort. And I believe that it could be a blueprint for many counties if we are able to proceed successfully, as I believe that we will be. So imagine those who have the most influence and the most power collaborating with those at the grassroots level, partnering together. So from both sides coming together to uplift a whole county. So hope, yeah, I have hope.
Great. Thank you, Schlo. Helen.
Congratulations, Pastor. That's amazing. I just wanted to say that. I think where my hope lies is in the future generation. And the fact that there's so many, as was being talked about earlier with Christine, there's so many funders that are investing in the future of our children and recognizing the value of rural in the Southern tier. One of the things that I also have hope is we, through our Co-Creating Wellbeing grant, we're able to partner with the University at Buffalo School of Social Work and IDIC to do an Allegheny County Trauma-Informed Champions project. This initiative provided us the opportunity for a year-long learning collaborative for 30 professionals in Allegheny County to come together. And what we've seen transpire from that is a new sense of urgency and a newfound energy in relation to making a better and improved quality of life and having Allegheny County being a place to live, work, and play and worship. And so I think in the past, what we have looked at it, through advocacy and having to be louder and having to be assertive as a rural community, we're now, we're being heard. And I want to thank the foundation for that and for everybody that's here. In the past, we were invited to sit on boards or to on state or regional or federal boards as the token rural. They needed to fill a seat, so they needed to show that there was rural input. So we were kind of that token rural. Allocations are often awarded regionally, and allocations often go to urban centers and maybe trickle down to the rural communities in the Southern tier, maybe not. If funding is based on population versus an equitable formula, which they believe is an equitable formula, urban counties see the dollars to our cents. And so I think as we're moving forward, we're seeing a shift where we're feeling valued. There's opportunity for feedback, and just having the report itself and being recognized is so important.
Great. Thank you, Helen. We're almost out of time, but I do want to give Tina and Christy real quickly, what brings each of you hope? And then we're going to turn it back over to Diane.
Thank you, Kate. I'm probably, terminally optimistic. I wouldn't be in the work that I'm in for as long as I have been, right? But I think that, where we're lacking in our community in terms of funding and resources, we make up for that in terms of partnerships and passion. And, when we look at this report, I don't think that we can talk about these issues individually, because poverty and trauma and trust and social justice, they're all legs of the same table. And I think that our community is beginning to really recognize that. And we're starting to have a common language around voice and choice and trust and empowerment and belonging. And that's what really gives me hope.
Wonderful. Thanks, Tina. And Christy, you want to say a few words here?
Yes. I have a few things that I'm really hopeful for. Number one, honestly, a panel like this always gets me excited because, just like I don't remember if it was Helen or maybe Tina just said, we're in these roles because we are so passionate and we're not set out to be millionaires. It's because we truly believe in what we're doing. So everyone on this panel truly gives me hope. The other thing that gets me excited is whether it's our kids that we see every day that I say is the future of the Y, because they're our future staff. And so I'm always telling them, you guys got to follow the rule because pretty soon you're going to be running the place. But the same with our staff, when we see that spark of excitement and they know they're making the difference in a child's life or an older active adult's life, like you can see that spark in them, and that means we're doing everything right. And the other thing that was kind of excited about today's call that gave me hope is tomorrow's actually my last day at this Y, and I'm actually going to the Ithaca Y, which is in Tompkins County. So I was really excited that there was tons of Tompkins County people on this call. So that was really exciting. So there's just so much to be thankful for and have hope for in the work that we do, quite honestly. So
wonderful. Thank you, Christy. Thank you all of the panelists. You've been wonderful. Diane, back to you.
Well, what gives me hope is that there's all these fantastic people working and living in our rural communities. And I'm very thrilled to hear about the grassroots efforts that are going on in those communities. At the Health Foundation, we believe doing better starts with communities coming together to have conversations like this. And I'm happy that so many people were able to join us to listen for a little while to members of these Western New York counties that are making a big difference. Because we believe conversations like this make a difference, especially ones where people come together and talk about what's working well and how to make the most out of what's working well, but also where are things not doing so well and how can we do better? Because we believe that dialogue is so important. We have created a micro grant fund, a new micro grant fund to support dialogue, learning, and action planning related to community health needs in rural communities. Applicants can request up to $5,000. These funds can be used to cover costs for a wide variety of activities to nurture dialogue and spark action, like the activities the panelists talked about today, whether it's bringing an inspiring speaker to the community, providing stipends to members of the community so that you can get their perspectives, or compensating a facilitator to have a really action-oriented workshop. The things that this grant can cover, are really endless. And we've set up a very simple application for folks who want to apply, including a way, if you're an individual, grassroots individual, and you're not affiliated with a 501c3 nonprofit, the Health Foundation will work with you to help connect you. to an organization that can help you to get a grant from us to support that kind of work. So that new micro grant fund is open today, and we'll accept applications through the end of the year. I want to thank all of our panelists. I want to thank Kate and Sharon and all of you for joining us today. We will be sending an email out to you with information on the micro grant fund, a link to a post-webinar survey, which we've also put in the chat. If you'd like to fill that out right now, we'd greatly appreciate it. We very much want to know what issues are happening in your rural communities that you want to raise up and raise awareness of. So with that, I want to thank everyone today. We saw your questions. I'm sorry we had such a brisk conversation. We couldn't get to them, but we did see them, and we'll work on getting together a list of those coalitions that the panelists mentioned to you and getting that out. So please look for that email. And again, thank you all for joining us today and giving us a couple extra minutes. Okay. Have a nice afternoon, everybody.